have a small confession. Doctors make me scared. Yeah, it's the truth. Cause like, I don't know, I always wanna poke you and there's needles for every time and I don't understand, and then I'm not gonna lie, I've had some pretty dumb shit said to me by doctors before. Usually mental health professionals. Let's not hyperanalyze that subject. But, it's, I think the most egregious thing I was ever told was, I couldn't have ADHD because I was a girl and over 18. Because, you know, girls never have ADHD. Bullshit. And, I guess when you're 18, regardless of gender, it's just supposed to go away magically. So, sorry to all my fellow it didn't go awayers. That's okay. We're cool. Regardless, I'm just a layperson. I'm not a doctor, so I don't understand all the time when someone says something to me that I should know is douchey. Especially because I can't super read social cues, but we'll get into that another time. That's for another video. That is not for today. But you know who is smarter than me? Oh, I guess a lot of people. But Dr. Mike is the one that we're going to be listening to today. He will help us out. He will educate us, and maybe you and I will be able to be more capable and more of a participant in our own healthcare, because I feel like that's important. Like and subscribe to, you know, to me, but also to the original content creator if you're not, although he has, again, 11.5 million subscribers, so, you know. Listen, still support Dr. Mike. He seems like a very nice person, and he's got actually very entertaining content. So, without further ado, let's go! Honestly, I've had a lot of shitty takes from doctors, I guess, if I think about it. Like, I also have chronic pain, and that's just something I try not to fucking bring up anymore at this point, because they just want to prescribe you, like, crappier and heavier crap, and it's just like, but could we fix it? Please? No? Okay. Help us, Dr. Mike!
Let's take a look at the Reddit thread of the worst things doctors have said to people.
That's a thread?
After my professional boxing match with Chris Avila, I went backstage where they do a medical exam. The doctor that's supposed to check you over literally goes to me, "Well, you're a doctor. Are you okay?" And I said, "Yeah, I feel okay."
He just got hit in the fucking face!
I'm like, no. Check me and make sure I'm okay. Check my pupillary reflexes. Don't just ask me, "You good, bro?" and consider that.
Wait. If you good, bro, is like, I think I could be a doctor.
A medical exam. Just because I'm a doctor doesn't mean I can take care of myself in a situation where I just got done getting punched in the face.
Oh my god,
when
yeah,
his brains
are scrambled.
My endocrinologist took a good look at me and asked, "Are you okay with your face being so asymmetrical?"
What?
I've never really noticed it before, but boy, have I noticed it since. I need
What
more
the
information
fuck?
on this, because initially my reaction, my gut was to get offended, because why are you judging someone's appearance? But
Why are you, that's... Are you okay with your face being so asymmetrical? I don't know how I could sit through that without responding, "Are you okay with being such a fucking prick?" Damn!
Then I looked at the specialty of the doctor that said it, endocrinologist. This is a non-surgical specialty, so this doctor is usually not the one performing surgery or recommending to perform plastic surgery or appearance surgery. What endocrinologists do look for is asymmetries in glands, because glands release hormones. And now an asymmetry on the lower portion of your face or perhaps your neck can signal to the endocrinologist that something unusual is going on in that gland. Therefore, they would be pointing out asymmetries.
I suppose, but I do feel like there's a way to word that that's a little, I don't know, less like making of a complex? Maybe that's just me.
shouldn't point it out like that where it could be easily misinterpreted, but they should say something along the lines of, has your face always been asymmetrical? Because when you ask it that way, then you can explain to the patient why you're asking. Because if it's been there for a long period of time, that means nothing's changed. That's the way you were born. As opposed to if over the last 2 weeks you didn't notice it, but wow, this side is more full.
Okay, then how about this? I'm not a fucking doctor, and I'm not trying to step on Dr. Mike here, but why don't you say, hey, have you had any recent changes in the shaping of your face, or have you noticed any more asymmetry than maybe was there before, or something like that? Like, that's a perfectly fine way to put it if you're just looking for a change in, like, their body and stuff. Just being like, hey, why is your face so fucked up? Are you cool with it? That's a little harsh.
Then we can act and start an investigation. A nurse of some kind took my blood pressure. He said what the numbers were. I asked, is that good? He said, I'm not qualified to give you professional opinion on the matter. You should ask your doctor.
Oh.
I asked, but like unprofessionally.
Unprofessionally.
He said, unprofessionally? Well, in my purely personal opinion that I'm sharing with you as an individual and not in any medical or official capacity whatsoever, you should buy stronger deodorant. Oh!
What? I don't think that nurse fucking liked you, boo. Oh no, but I'm not gonna lie. Like, anytime they've taken my blood pressure, I'm always like, am I good? Am I dead? And the nurse will, without hesitation, be like, yeah, this is good. Or, oh, we can work on this a little bit. This is insane. What did you do to the nurse? I'm not trying to victim blame, but, like, if they went straight for the deodorant joke, like, how many times did you hit that fucking button?
Oh man. Yeah, just wait for the professional advice. You have pretty blood.
What?
Followed by, I bet you have heavy periods. What? That is some vampire-ish. I've heard people say
Vampire is a weird way to say predator.
Goddamn vampire.
I'm trying to think, even if you're like a lady plumbing doctor, I don't want to hear you say that I have pretty fucking blood. That's terrifying. That's horrifying. This person is going to murder you.
you have pretty veins, but they're not actually commenting on the beauty of your veins. What they're commenting on is the fact that it will likely be an easy blood draw. Because if you can visualize the veins, it's a lot easier to not have to repoke you multiple times because they keep missing.
No, get the needle off my
does not dictate whether or not you have heavy periods is what I'm trying to say. Not me,
it's so
but
weird.
Mom. She's in remission for non-Hodgkin's lymphoma that invaded her brain. She was getting a scan to confirm the cancer had left her brain, and the doctor came in and said, "Good news, we've scanned your brain and confirmed that there's nothing in there." This is a common joke. And I actually say a variant of this.
I was gonna say, I'm like, I wouldn't take too much offense to that. It's just silly.
I look at the other end, I'm like, wow, I can see completely through. I guess there's nothing in there.
Of course, I spend a lot of time on this channel calling myself out for being silly and a little bit dumb in some things. So, that wouldn't offend me.
A better one that I do with kids, because they're always like nervous what you're looking at and they don't know. So I say that I'm looking in their ears and I go, wow, I see someone's been paying attention to math. It's all really sticky. They go, really? I don't even pay attention to math. My gynecologist, while trying to remove my IUD when the strings weren't visible and fishing through my cervix with local anesthesia.
Oh, thank God.
Come here, kitty, kitty.
What the fuck?
He spaced out, was very concentrated to avoid unnecessary pain. He was most definitely has cats, and the word just came out. He burst out laughing with embarrassment and said, sorry, more than I could care to count. Honestly, I thought it was hilarious. I've been seeing him for a long time for many IUDs, and he's a gem. Okay, the only thing that troubles me about this story is many IUDs, because, for example, some IUDs are meant to come out after 5 years, although they could stay a little bit longer, and there's some that stay in 10 years. I mean, unless you've been seeing this doctor for decades, many IUDs is cool.
I almost started talking about IUDs and my thoughts on them, and I thought, my demographics are predominantly men. That's not going to be very relatable. Listen, you guys don't understand, so it's fine. Spoiler alert, IUDs fucking hurt from what I've heard, and there's so much potential for them to go wrong. Be nice to your girlfriends! or I'll haunt you.
Kind of interesting. For those who don't know, IUD means intrauterine device. It's like this little T-shaped thing that we insert into the cervix that is a contraceptive. It prevents you from getting pregnant. It's actually quite effective. The strings that we're talking about are strings at the end of it that end up coming into the vagina that the doctor then ideally should shorten to some degree. If you cut them too short, they could actually be sharp. You won't be able to reach it to pull it out and put a new one in, or just remove it in general. Doctor here, and I really hate to admit this, very early in my career I was talking to a male patient. I had to ask him about penile discharge, and I couldn't remember what the professional way to ask was. Do I say, no, that's not right. Come on, think,
Sweetie,
you're a doctor.
penis.
Wait, there's too long of a silence.
The word is
Dong,
penis.
with dong.
Oh!
An easy way out of this is just to point to the region. Say, I discharge.
Just point at his junk. Any discharge down there, sir? Oh god, I could never have a penis. I wouldn't stop giggling.
Down there. And then if they have questions or they're not sure which down there you're talking about, then you could specify. What I run into is the issues with poo. Do you say number 2, like you're a 4-year-old? Do you say bowel movement,
Fecal
like
matter.
you're a GI professor? Do you say poop?
Fecal fucking matters, Mike!
4-year-old and you graduated from number 2? Or do you say crap? Like what feces?
There,
like,
we're getting
like you're
warmer.
an archaeologist? What is the term? I usually lead with bowel movement, and if I sense confusion, I say poo. What would you do?
I think I'm a poop guy, but I'm not happy about it.
Oh,
Fecal
and I hate saying
matter.
stool. How does a chair make its way into your large intestine, rectum, out of your anus? You're looking pleasantly underweight. I
think
don't
this is the first
know
time
what
we've
that
discussed poop
means,
this
and
much
that
on this
is
channel.
Disgusting. A doctor
Whoa!
should not put flirtatious undertones on talking about someone's health. We learned this
Especially
very
not when
early
they're
on,
underweight. That's
where
awful.
We listen to someone's heart or their lungs, and we're taught to say things are normal as opposed to good or perfect, because they can easily be misinterpreted. In fact, when we do our simulated patient encounters where we work with patients to perform a pap smear, a digital rectal exam, which is a finger in the bum, when we do those simulated encounters, we're taught, instead of calling the pieces of metal that patients put their heels in, instead of calling them stirrups, call them footrests, because those carry implications. Instead of saying, I'm gonna insert my finger.
I'm not
you're
gonna
say,
lie. This is again just a weird conversation for my male demographic channel. But we're here, babies. Let's go. It's really fucking disturbing when they're like, use the word stirrups has always been used, and I'm not a horse. I'm not riding a horse. I don't want to ride a horse. I just want to make sure I'm not like getting the C word. Bodies are so fucking weird, you guys. Okay, onwards.
my digit. There's ways to make medical exams more comfortable, and I think we need to do a better job
The
in the medical
term
community. than
pleasantly
saying
underweight.
ridiculous
What does that
you're
even
pleasantly
fucking
underweight.
mean?
Back pain, I'm not young. Doctor just said basically, well, that's just life for you. You're tall. So I'm just going to end up being hunched
Awesome.
over 90-year-old. Lol, you're not going to see 90. How
Wow. I don't even think we're fucking through this, but like I've had this experience where you're like, no, I'm in a lot of pain, and they're just like, and what of it? It sucks. And it's like, okay, okay, but you're I went to the hooman repair shop. Why aren't you fixing it? What the fuck? Hello? Shout out to all of my people who suffer from chronic pain or any chronic illness or any kind of... It's rough out there, guys. I see you, even though nobody can actually see... Like, it gets frustrating because you're always just in pain every fucking day, and it's not visible in most cases, and you're just dealing with it, and nobody understands. And I'm really sorry if you're going through that. Foxy loves you. I get it.
How many tall old people have you ever seen? Yeah, okay. Yeah, that's
messed up.
That's douchebaggery as a person.
No
Forget
shit.
doctor. You're just being an asshole.
I bet he hated that person for being tall.
Friend. She had just gone through a miscarriage after trying to conceive for a while. Since she was quite young, the doctor asked, well, you didn't really want to have the baby, right? That's
Get
really,
fucked.
really wrong.
Get
you could
fired.
Be really hurting someone who just lost a
There
child. The question you need to ask
It's
is,
fucking
well, how
trauma.
do you feel about this? If the patient is willing to open up and wants to share, you could then build off of it. It's very common that a patient of mine will present the situation like, I just got divorced. Typical human reaction is
awful.
to say, I'm sorry. But me as a medical health provider and a mental health provider, I oftentimes will say, well, how does that make you feel?
I've
Because they might
actually
be like,
done this.
I am so happy. That was the worst time of my life, and now I'm stoked. And I would be saying, I'm sorry to that. Which is not
I will
really
honestly be
So now
like,
I say,
if
how
one
does
of
it
my friends is like, "Oh, this thing is going on," and I'm really like, I've had this conversation before, and I'm just like, "Oh, that sounds really intense. How are you doing about it?" And then that's literally all you have to say, and then you get the answer that you need. They'll either go like, "This is really fucking hard," and then you know, like, okay, we need to support and cuddle. And if they're coming out like, "Motherfucking pizza," then you know, like, okay, let's get drunk and talk some shit.
make you feel, and then we build off that. Your breast tissue is extremely dense, which I'm sure your husband enjoys, but it's making it difficult to get a good view. Oh my God. That's inappropriate on so many levels. In younger women, it is common that they have more dense breasts. Therefore, we don't often just do a mammogram if we're suspecting cancer. We also do an ultrasound. In fact, ultrasound sometimes gives us
I'm
better
trying to
views.
think
And
of
even
something
then,
to
it's
say,
sometimes difficult to
but
catch
I'm
things.
just filled with
you do get a more
homicidal
difficult
urges.
view with dense breasts, but you shouldn't talk about people's sex lives if it's not appropriate to the healthcare. I asked my cardiologist I had growing up what the goop was they put on before echoes. He said yak snot. I believed him for a week. Well, first of all,
That's
where was this
funny.
cardiologist that they're even aware of what a yak is? Where are there yaks in such numbers
Hi,
that the
Mr.
first
Yak.
animal snot that comes into this cardiologist, it's not even a regular doctor, a cardiologist's mind is yak. Where are yaks' homes?
Mongolia, I think.
No, you don't act like you know that.
Chinese-
You are not allowed to act like you know that.
Sam is right. You're not allowed to act like you know that.
If you don't need these pain meds now, you can save them for another time. ER doc giving me a full bottle of Dilaudid for a broken thumb. The early 2000s were a wild time. Yeah, that's now. There's
That's
rules
insane.
in place that actually the ERs can't give long-term prescriptions. And that's both good and bad. Good in that you're preventing opioid addiction and patients overusing them, abusing them, selling them, what have you. But also it creates issues for patients that aren't able to get in to see their doctor because doctors are so booked up. Therefore, they're stuck sitting in pain. One time I went in for a general checkup and my doctor said, well, everything is fine with you except for that haircut. I hope you know that doctor really well.
I was gonna say, I'm like, how many of these fucking doctors are just using like your fucking appointment for their open mic practice? What the hell? I've had like kind of douchey doctors, but never like, that was never part of it.
You're not depressed, it's your personality. It took a while to get over that statement and give medication another try. Could this statement be made genuinely? I think not. Because what they're saying is not even medically accurate. You can say that you don't meet the criteria for major depressive disorder, which has very strict DSM-5 criteria.
Yeah,
which
but
is the
saying your personality is just, oh, you were just born and meant and intended to suffer and dislike life and be miserable. Quit whining about it. Fuck you. Ugh. If you are suffering through any mental health troubles, babies, I listen, I am too. I don't have all of the answers, but I do know that the right decision is to keep trying, even if there's dick bags like this along the way. Mwah.
Diagnostic and Statistical Manual, 5th edition, that we use to make diagnoses of mental health conditions. Depressed is a mood. I can be depressed right now. It doesn't mean I have major depressive disorder, nor does it mean it's my personality. There are people who their personality trait can lead them to feel depressed. And there's a whole set of personality trait disorders that can lead someone to feel depressed. There's also something known as dysthymia, which we talk about quite often, which is
Milder
a
but
low
long
mood,
lasting.
but not necessarily all the way to full depression for an extended period of time. But saying you're not depressed, it's your personality is wrong for multiple reasons. You're not depressed is a mood. You can't tell someone what their mood is. And saying it's their personality is not even a medical term. Personality trait is, personality is not.
It's also your You're taking the hope away from that person. This person came to you because they wanted a change. They don't enjoy the way their life is going. They're trying to make a change. And you're literally telling them, no, that's just how it is. So, suck it. That's fucking awful. I'm Gang, I want to hug all of you right now. I'm so angry. I keep thinking something. What? If anything of this happened to you guys, we're going to war.
If you want to help people, don't go into medicine. As a doctor, I'm nothing more than a people mechanic, and much like a car mechanic, I patch people back together well enough to get them out the door until I see them again. If I could go back, I'd run as far away from medicine as I could.
What?
If a doctor said that to you, that's kind of strange.
That's a very jaded way to look at it. I mean, I'm trying to think, because I did make this joke earlier, that, you know, the hooman repair shop, but by the same token, like, if you want to help people, don't go into medicine. As a doctor, I'm nothing more than a people mechanic, much like a car mechanic. I patch people back together well enough to let them out of the door until I see them again. What are you expecting to happen? I guess I don't understand. You can't cure someone to the point where they never need you again. What?
A fair critique to some degree, because the field of medicine is plagued by a really bad system behind it. Even the idea of patching people back together, that's a win. That's days you're giving back to a person to be able to be symptom-free and continue on their job, see their family, do things they love. Even if you're giving them back a year until they see you again, that's a win. Yeah, they may come back multiple times because humans do break.
The unfortunate thing that I think this doctor that posted this is, and I mean, they've obviously deleted the account or something. I feel a lot of burnout in this statement, and I feel awful for that, but I feel like medicine is a constant, like, you're just there to fight off death. And sometimes you're never going to win, because death is literally just the only fundamentally knowledgeable, like, it's the only guarantee we have. So, like, I can totally understand where this person came from and how this can, like, be dehumanizing and exhausting. But by the same token, like, I don't know, maybe I want to hug this person. Are you okay, OP? Do you need to talk?
And the beauty about humans as opposed to cars is cars don't fix themselves. Humans do. And it's our job as doctors to facilitate that healing and figure out how to remove risks to mitigate the times that the body does break down. Were you a teacher? Your bladder is huge.
What?
OBGYN during a pelvic ultrasound. I was indeed a teacher. Do teachers have big bladders? Is that like a
I'm
known thing?
confused.
They have to hold it because they're teaching classes for so long.
They have a lunch and
would
stuff?
Would that cause a bladder to expand? Is that a thing?
I don't know.
Is a bladder flexible like that?
Well, a bladder is muscular, so it absolutely expands, it stretches. But to say that it stretches past normal, like that it doesn't rebound, that's the weird part. You have a brain
Does anyone else have to pee now?
tumor, but that's fine. Okay.
What?
I maybe hear the message, but I think it's delivered incorrectly. And I know people are going to be like, what do you mean? How's a brain tumor fine? There's some brain tumors that are malignant. They're going to spread. They're going to grow. They're going to be problematic. There's some that are benign, meaning that they're not malignant. They're not going to spread. They're going to stay in the area. But they can cause mass effect, which means that they press on certain areas of the brain, which obviously causes a huge issue.
And
And therefore, they're a problem.
in the meat suit.
And then there's other ones that are truly just benign. It doesn't matter. Like, you can leave them, forget about them, and you don't even need to follow them. That's on the rarer side, but they do happen. So I'm hoping that
this just goes back to another one of those, like,
really
you could have worded that so much better.
relaxing your cervix.
What?
Weird compliment, but I took it, damn it. She sounded so excited. Can you even relax your cervix? Like, I don't think that's a thing.
I almost added in a personal anecdote. I'm not going to do that. We're moving on now.
This is no joke. I had a medical professional say, I used to be a heroin addict, so I'm pretty good at this. As she was putting in my IV. That's on my last. Okay, some people will.
I do
see
like this
negatively.
person.
I agree with the writer, and I think this is funny.
Yeah.
And
Honestly, like, I understand, like, so it's an intense thing to be hit with right off the bat, but by the same token, like, this person's turned their fucking life around. That's awesome. That's amazing. I like that this person that posted this laughed at it. That makes me happy.
I think it's also appropriate to say, because I think those who have overcome challenges and have experienced certain things can provide value. And if they're being
They have
forthcoming
a
with that
ton of
information, as
knowledge
long as
and
it's not
experience
inappropriate,
that they
I
can
think
share,
it's
and beyond that, like, that
valuable
was
to share.
funny.
I've worked with a
It's
lot of
fine.
psychologists and addiction
And
specialists.
she's not wrong. Like, she's probably got more time behind the needle, practically speaking, than most of her fellow students in her graduation class.
who have suffered with addiction themselves. First-hand experience really goes a long way in being able to function as an empathetic provider. Following a checkup, we're going to have to remove your testicles. Just kidding. You should have seen your face.
Fired. New doctor.
I don't know what to, like, it depends. I know you probably didn't even expect.
When I hear shit about testicles, now granted I understand getting hit in the balls is not quite the same thing, but I always think, like, if somebody was just, like, a doctor was just like, I'm gonna have to remove your left breast. Just kidding! That's not funny. No part of you is funny. People actually do have to do that, and it's terrifying. Fuck you.
Expect me to say it depends. You probably are like, no, he's going to critique this. But, like, I've gone into the room, a patient that I've known for years has something on their arm, and I go, oh, man, looks like we're going to have to amputate.
Yeah, but that's
They
not
already
your
know I'm probably
freaking
joking, so they get it.
personal
And the reason they know
body
I'm joking
parts
is not
of the
because of my
personal
tone.
personals.
In fact, it's the opposite. My serious tone and directness just jumping to amputation teaches them that it's a joke. Because they're so familiar with me, they know that if I'm breaking bad news, I wouldn't do it in such a careless way. But again, it can only happen as a result of good long-form communication.
Yeah,
that
it
we
is
have,
hard to
which is why it's
determine if
important to
this
get a primary
person
care
in this
doctor.
post had
I
that
love
with
that we
their
went
doctor.
from testicles to talking about primary care doctors. Things you should never do in a hospital. Click here to check that out, and as always, stay happy and healthy.
Yeah! Thank you guys for hanging out with me. This has been awful things doctors have actually said to patients. If you have your own stories, I encourage you to post them below if you feel comfortable and you want to. There's no pressure because honestly, like, a lot of the doctor discussion stuff turns out to be pretty private. So, like, you know, do what you want to do. But if you do have stories that are not too private to share, I will be happy to read them. And please like and subscribe to the original content creator below, as well as support any if you enjoy his content, please support it. And if you enjoyed this video, which clearly you did, you're still here. Like, look at the bar down there. It's about to end. You know, like, we're almost done. And you know what I'm gonna say. So you do it. Like and subscribe, damn it! Thank you guys so much for hanging out with me. I will see you next time, changing. Bye!